Good evening. Happy Good Friday. This is Dr. McDaniel. It's really late tonight. I had a very busy Friday and we didn't have office hours today, so I've been running around for most of the day. Let's see. Yesterday, Thursday, was 18th. Today's Friday, April 19th. And yesterday I responded to a viewer's question about urinary leakage or leaky bladder. She complained. So I spoke for about 20 minutes. I'm going to try to keep these down to 10 to 12 minutes or so. So I spoke a little longer than I anticipated I would yesterday. But in summary, I stated that there are a variety of reasons for urinary leakage. The most common for women is going to be genuine stress incontinence or urinary incontinence due to increased abdominal pelvic pressure from coughing, sneezing, exercising, jumping jacks, anything that puts pressure inside the abdomen and the pelvis. That's the most common reason for women. A variety of sources that cause that would be, most common is going to be pregnancy, because the heavy belly puts a lot of pressure on the pelvic muscles. After that, it's going to be frequent coughing, so if someone has chronic asthma or COPD, chronic obstructive pulmonary disease, or they're coughing a lot. Another reason could be constipation, if someone's bearing down, straining frequently because they're constipated, plus having constipated intestines puts a lot of weight on the pelvic muscles, which act like a trampoline. Let's see, anything that puts, if someone has a job or any kind of hobbies where they're lifting weights, or they're lifting heavy boxes or objects, so they're straining, bearing down a lot, lifting things or carrying things. So anything that puts increased intra-abdominal pelvic pressure, stress will put a lot of pressure, stress on those pelvic muscles and weaken them and make them lax. Of course, lastly would be weight gain. So increasing your weight by 40 pounds or more, especially belly weight. And obviously childbirth, that puts a lot of stress, strain, pressure, wear and tear on the pelvic muscles. So all of those will lead to stress incontinence or urinary stress incontinence. I mentioned that other sources of urinary leakage could be inflammatory disease of the bladder muscles itself, so totruser instability, where the bladder muscles respond inappropriately to pressures and stresses in the pelvic area. Another common one is interstitial cystitis, which is an inflammatory disease of the bladder tissues. So the person feels like they have a bladder infection because that's an inflammatory disease due to bacteria. But interstitial cystitis is an inflammatory disease due to inflammatory changes in the bladder muscle. So that could be autoimmune, so your body's fighting itself, or could be due to endometriosis or abnormal tissue implants in the bladder muscles. So lots of different reasons for an inflammatory response of the bladder tissues that causes urinary symptoms, including incontinence. Another reason could be urethral problems. So the urethra, the sphincter in the urethra, the muscle that closes off and tightens off the bladder, doesn't work properly. It's not strong enough. It doesn't close down or clamp down well. So with any kind of stress or pressure or increase volume or distension of urine in the bladder, urine leaks. Those are some of the big ones. I also mentioned yesterday about the evaluation process, looking for infections, looking for physical problems like stones, tumors, masses, growth, polyps, abnormal blood vessels, looking for changes in the bladder form, ureter, including the ureter, which is the conduit from, or the tube from the kidney to the bladder. And I spoke about testing for urinary problems. So urodynamic testing, which measures how your bladder responds to different stressors, pressures, and the filling of the bladder. All of those lead to the diagnosis, and I mentioned several of the diagnoses. A lot of people would like to know what kind of things they can do on their own, homeopathic regimens that they can do on their own to alleviate bladder symptoms. Obviously, that's going to depend on why you have the bladder issues. If the bladder issues from urethral problems where the sphincter is not closing, you're not going to be able to do anything for that because it's a matter of the muscle, the sphincter that closes off the bladder, not being tight. So there's really nothing you can do for that one. We used to give people special diaphragms, which are little rubber or plastic forms or kind of devices that you put in the vagina, and it puts pressure on the neck of the bladder to the urethra, so it basically physically just pinches off the urethra. Those are passé now. They're really difficult to find special devices or prosthetics that you can put in the vagina. They're almost like diaphragms, so we don't really have those anymore. We used them a lot in the 80s, up to around the late 90s to the early 2000s. We used them a lot to help with leakage problems. They've really fallen out of favor because women now more go towards surgery. So fillers, collagen fillers, protein fillers, injections you can place in the sphincter that will close it off, and the person can just put a tube in to drain their bladder, or surgeries where you put basically a sling or like a rope you pull up to close off the urethra to pinch it that way. If you have stress incontinence, a lot of people are aware of Kegel exercises, where you're basically just throughout the day frequently trying to tighten up your pelvic muscles to increase the strength of your pelvic muscles. And the Kegel exercises are essentially, you pretend like you're urinating and that you're trying to stop the flow of urine. So you tighten the muscles that would prevent you from urinating. Or if you really, really have to go, and then you tighten the muscles because you don't want to leak urine on yourself, that's the kind of exercise you do. So you do that throughout the day, all day, for day after day after day, every day. Those Kegel exercises in theory work really, really well in practicum. So in the real world, in reality, they don't work so well. I suppose it depends on the individual, how motivated they are to do the exercises, and just how their body responds to the management. Another option are physical therapy techniques, where they will do a lot of directed tightening. So they put pressure, physical therapists put pressure on the pelvic muscles to increase the person trying to tighten. There are also vaginal weights, where the person puts a little ball basically in the vagina, and they try to constantly keep that ball from falling out by tightening those same muscles. Those are some of the usual techniques for that. They work so, not all the time. Most people resort to surgery, basically procedures that tighten up the pelvic muscles and lift up the pelvic muscle so it doesn't have a lot of give. If someone has interstitial cystitis or detrusor instability, any kind of abnormal inflammatory tissue responses, then a lot of people will try dietary changes. So decreasing the acidity of their urine by cutting out a lot of foods, tomatoes, spicy foods. A lot of people will cut out certain trigger foods that they have had experience, so it's kind of a trial and error. The big ones are spicy foods and certain meats or deli products. Those are the big ones. Bell peppers, any kind of hot peppers are trigger foods for most people. The Urology Journal and the American Urologic Society, they have bulletins on the internet that give a list of dietary recommendations. Treatments that people can do for interstitial cystitis. I know a lot of people get infusions, either steroids or anesthetics, to decrease the inflammatory response of the bladder to urinary pH changes. And I I mentioned yesterday that cystoscopy, put a camera in the bladder to look for abnormal changes. Some women with interstitial cystitis will have very superficial, minute little ulcers or lesions inside the bladder. They can surgically burn those off, and that will often help the management or the treatment of that discomfort, pain, burning, and urinary issues. So let's see, that's a lot of information, and of course I run over my time. I hope that's helpful, and I hope that helped the viewer who had questions about the leaky urine. Obviously, the most important thing is to do a little bit of research on your own. It is good to have some knowledge and information, but you'd have to see a specialist. That would either be a urologist or a urogynecologist, which is a gynecologist like me who's done several extra years of training, usually 2 years, sometimes 3 years of extra training in urology, bladder issues specifically, which affect women predominantly, in order to help women on a gynecological level and a urological level to help diagnose, manage, and treat their urinary issues. So this is Dr. McDaniel coming from home late, and it's Good Friday, so happy Good Friday. Tomorrow's Saturday. I am committed to broadcasting every day. Hopefully I'm going to try to get in there a little bit earlier tomorrow. I had a lot going on today. I hope these broadcasts or live streams are beneficial to everyone, and if you have any questions you'd like to present or pose for me to address in the live stream, I'd appreciate it. It's nice, it makes it interesting, and I can feedback on issues and information that people want to hear, not just what I think they should hear. Tomorrow's Saturday, so tomorrow I'm going to try to broadcast earlier in the day. We're doing some traveling tomorrow, so the girls won't have the horse riding lessons. I won't broadcast from the horse farm tomorrow, but I'll broadcast as early as possible tomorrow. Have a good night. Thank you for watching. Take care.